Now, health experts have warned of a risk of a second wave of COVID-19 in the country following the further easing of lockdown regulations. There have been some concerns that people are letting down their guard and not adhering to the coronavirus safety regulations. Social gatherings appear to be super spreaders of this virus. Just last week, a Cape Town nightclub made headlines where dozens of people tested positive for COVID-19. Joining me now to expand this discussion is Dr. Glenda Gray from the South African Medical Research Council. Dr. Gray, very good morning to you. Thank you for your time. Various health experts are essentially raising the red flag over the COVID-19 resurgence in South Africa, warning the dangers of relaxed behavior. What sort of impact is this extension likely to have on the virus? More especially as we approach the December festivities, pardon me.
So we do expect an increase in COVID transmission in South Africa as we open up the country. And the most important thing is to try and make sure that we implement our non-pharmaceutical interventions, wear our masks, have physical distancing and avoid crowds and congestion. So we do see fatigue, and we're seeing it in Europe. People get tired of wearing masks, and the moment you let your guard down and you stop practicing non-pharmaceutical interventions, you will see increasing transmission. And so our job is to try and make sure that we limit the onward transmission so that we can make sure that when we do have a surge or when our cases do increase, our medical facilities are able to manage those who are sick.
Now, if the massive outbreak linked to the Cape Town venue where around 89 people tested positive for COVID-19 is anything to go by, could you say that the warning signs of an upsurge are clearly evident?
So I do think we do expect, as you open up the country and as people mix, you will see areas of hotspots. Even if you look in Europe, there was a yodeling contest in a small town in Switzerland, and that caused a massive outbreak in that area. And so we have to make sure that when we do socialize, that we protect. We have a duty to protect everybody who we're in contact with, and so we have to make sure that patrons who go to these institutions, these clubs, the people who manage them, the managers, the bartenders, make sure that you implement these interventions. And so we have to be on our guard. We can't allow to be fatigued about coronavirus. This virus will be with us for a very long time, and we have to try and manage its spread until we have a vaccine or until we have other ways of treating the disease. SARS-CoV-2, although it affects a lot of people, will be asymptomatic. There are people that are vulnerable in our country and who will die if they get infected. And so it's our job as citizens of our country to make sure that we protect the people who are most susceptible to having adverse effects of SARS-CoV-2.
As you make reference to what happened in Europe, what are some of the lessons that you believe that we can take from other countries that were hit by a second wave?
So I think in Europe and in the USA and in the UK, there's a huge reluctance to wear masks, and there's a huge reluctance to social distance and to implement measures that will protect other people. And so the wearing of public masks in South Africa is a very important intervention because it does help limit the spread of coronavirus in our country. And I think what we've seen in Europe and in the UK and the USA is disregard for non-pharmaceutical interventions. And South Africa has been really good at implementing non-pharmaceutical interventions, hand washing, social distancing. What we have to do is continue to make sure that we avoid crowds and congestion. As we open up our churches, conferences, we have to make sure that we implement good ventilation areas, and that we are fastidious in washing our hands and maintaining our distance. How we manage this epidemic depends upon us. It depends on the citizens of this country. And so we have to try and make sure we can slow down the virus as we open up society.
Now, the World Health Organization has warned of a drastic increase in TB-related deaths as the COVID-19 pandemic continues, saying that during this period, the high reporting and perhaps the monitoring of TB has waned down. Is there a concern for patients with TB and other chronic illnesses like HIV/AIDS? Could you say that South Africa can indeed afford to let its guard down, looking at that scenario?
So our health systems have suffered because of the epidemic, and we have seen TB diagnosis come down viral load testing for HIV, CD4 counts. We've seen women reluctant to go to antenatal care. We've seen a underusage of immunization. So people are scared to go to the healthcare system. And when you ask them, they say they're scared of getting coronavirus. And so people then will stay away. And if they stay away from the health system, it will affect their health in a bad way. So if you have got TB, and you don't go and get a diagnosis, you won't go into treatment, and then you will also continue to spread TB in your community. If you are HIV infected and you're not getting your viral load or your CD4 counts done, and you're not going onto treatment, you can also get sicker and also transmit HIV onwards. And so we have to make sure that our health systems can offer care to people who are not COVID positive, and make sure people who have chronic illnesses, diabetes, hypertension, get to the clinics to get their medication.
And what do you believe could be some of the big challenges within the clinics?
Well, I think first of all, hesitancy. People are scared to go to the health system because they do think there's an epidemic and they don't want to get sick from the healthcare. So we have to reassure people who come to the hospitals that they're going to be safe. And they're going to be safe if we make sure that there's no crowding, people maintain their distances, there's regular hand washing, masks are put on, and there's good ventilation. We should keep waiting queues outside, try and make the rooms where people wait for care outside, so they're out in the open and they don't have to be exposed to any congestion or poor ventilation. And so we have to continue to reassure the public that the health system is there to help them with their medication, and make sure that when they come to the clinics that we can protect them from any transmission.
There's also been a lot of talk about a vaccine, and it's reported that we could see one by the end of this year or perhaps early next year. What's the actual timeline around that vaccine?
So I think we're very fortunate in that there are a lot of vaccine trials that are in late stage clinical development, and we may see a vaccine towards the end of the year. We may see readouts. How that translates into South Africa, getting the vaccine, will be a different story. Obviously, if it's a vaccine that we've tested in South Africa and have good knowledge and understanding of, the processes of registration may be quicker. For vaccines that have not been tested in South Africa, our regulators will have to make sure that they're happy with the immunogenicity, the immune responses of other people, and make sure that they understand the correlates of protection, so that we can translate the findings from elsewhere into South Africa. And so what we hope will happen is that there will be an urgent attention to registering vaccines that are found to be efficacious, and that the regulators in our country will have to work very closely with the Department of Health and Treasury to make sure that we choose the right vaccine that's at the right cost, and we have the right access.
Now, questions about who will be eligible to get the vaccine and concerns of whether or not there will be enough of it are also an important factor to factor in at this time. How is it all likely to pan out?
Well, because there will be a shortage or scarcity of vaccines, one has to obviously prioritize who gets it first. And obviously healthcare workers who are at the cold face of the epidemic should be the first beneficiaries of a vaccine. Also, those who are vulnerable and elderly need the vaccine because we don't want them to die. And then you'd have to then decide, who else is at risk. So essential workers, the elderly and healthcare workers should be part of the priority of getting a vaccine. But obviously one has to navigate the process and vaccinate the people who will get the most benefit from a vaccine in the first instance. And then slowly, as access becomes more available, then you're able to vaccinate more people in the population.
Now, you've previously spoken, Dr. Gray, about the importance of minimizing the scourge of alcohol abuse and its impact on society. Looking at that analysis and those comments that you made at that time, and what we saw transpire at the nightclub in Cape Town, what do you think needs to happen as we continue to ease into the different levels of the lockdown?
So obviously alcohol disinhibits you, and you may not have you may feel that you are not vulnerable to anything. And I think it's important, if people are drinking, is that there is vigilance. We do need people who are at the nightclubs who are stewards or navigators, and making sure that when people's guards are down, their guard isn't down and that they wear masks. And so we have to ask restaurants, clubs, venues where there is music to make sure that there are people who are keeping an eye on the situation and making sure that we implement our non-pharmaceutical interventions. Although people at clubs may be young and they may have asymptomatic disease, they may transmit the virus to other people who are elderly and who may not be so lucky. And so both club owners and people who go to clubs must make sure that they adhere to the non-pharmaceutical interventions, because it's our duty to help protect the people who may not have a good outcome as we might have.
And very lastly, before we let you go, what are some of the trends that you're now noticing as opposed to several months ago as we go into the pandemic in a different depth?
So obviously we're starting to see what we call long COVID, the long-term effects of COVID. So COVID is a multi-organ disease, and there can be permanent damage to your heart and your lungs. We also see that a lot of people suffer from fatigue, what they call post-viral fatigue, and lots of other side effects from having COVID-19. So a large proportion of people will not be sick after 2 weeks, but there are people where the disease lingers on, and people do have a long-term effects of COVID-19, which we're still starting to understand. There's also the issues of reinfection, and we've seen the case of the woman who had cancer, and she had COVID, and then she got COVID again, and trying to understand the immune response and how long you get protected for if you do have COVID-19. And so there's a lot of things. This disease is 10 months old, this infection, this epidemic, and we're learning every day about new impacts of it. And so it's very important to make sure we understand what the long-term effects of COVID are for those who have it, and also to make sure we understand what the immune response is and how long you get immunity for. It's important for us to make sure we get a vaccine rapidly, and also that we understand what protects, what were the correlates, or what is the mechanism of protection, so we can quickly translate that to better and better vaccines so they can be more and more efficacious.
Very well. Thank you so much for your time and that very thorough breakdown. The South African Medical Research Council's Dr. Glenda Gray speaking to us there about COVID-19.